What's the difference between a rhinoplasty and a septoplasty? This is a question that I hear from a lot of patients who are confused about whether a septoplasty is going to change the shape of their nose and whether a rhinoplasty is going to improve my breathing. A cosmetic rhinoplasty addresses the external shape of the nose. Septoplasty is addressing the nasal septum, which is a structure inside of our nose. And our nose is an empty cavity in the middle of our face, and there are a few structures that help with flow. The nasal septum is a wall that separates the right from the left nasal cavity. This is a thin structure that's made of cartilage in the front and bone in the back. This can occasionally be curved, whether it's due to congenital or birth-associated aspects or trauma-related. Whatever the case, this can influence breathing. In terms of rhinoplasty, there are variations in terms of rhinoplasty. Rhinoplasty is really addressing the external shape of the nose. And there are three important structures that the external nose comprises of. There's the nasal bone, which is on the top portion of the nose, the middle portion of our nose, which is called the upper lateral cartilage, and then finally the tip structures, which are called the lower lateral cartilages. Variations in these structures can lead to not only cosmetic abnormalities, but also functional issues as well. And this leads us into the various types of rhinoplasty: cosmetic rhinoplasty, functional rhinoplasty, revision rhinoplasty, and ethnic rhinoplasty. Cosmetic rhinoplasty is addressing the external shapes of the nose and contouring those structures to achieve more aesthetically pleasing outcomes. Functional rhinoplasty is to address the structures of the external nose that are causing impairment of breathing or function of the nose. In revision rhinoplasty, we're dealing with situations where less than ideal outcomes had occurred in prior surgeries. For this, we often have to incorporate grafting, such as cartilage grafts, from alternative sources like the ear or the rib. Because of the alterations from the prior surgery, the healing is a little bit longer. We anticipate the nose to take about 1.5 years, 2 years for it to completely stabilize. And finally, I'd like to talk about ethnic rhinoplasty. Ethnic rhinoplasty has become very popular recently, and what it really entails is addressing rhinoplasties from different ethnic and cultural backgrounds and focusing on unique aesthetic outcomes. The big difference between ethnic rhinoplasty is that we're dealing with skin and soft tissue and cartilage differences that are subtly different and oftentimes require a different technique to achieve successful outcomes. We prefer to breathe through our nose because it helps humidify the air and warm the air as we inhale. If for some reason we can't do that, we have to compensate and open our mouths. It's a much more uncomfortable way to breathe. If we have a curvature in the septum, that can lead to disruption of the flow and ultimately lead to problems with quality of life issues such as sleep quality, exercise tolerance, and low energy. This requires a minor procedure to straighten out the septum, and this often entails removing portions of the cartilage and bone to do so. In general, I tell patients that the septoplasty, the intent of this is to address the breathing aspects, and really it doesn't address the cosmetic concerns. Oftentimes we recommend combining the two procedures, both the rhinoplasty and the septoplasty, if they're concerned with cosmetic changes. The ultimate question I get a lot is, which surgery is best for me? And for that answer, I recommend consulting with your ENT doctor or your facial plastic surgeon who is board certified in both ENT and facial plastic surgery to see if a rhinoplasty or septoplasty is best for you.